So here's an interesting experience that I had recently. I have a client who had some cardiovascular issues and had some blockages in the arteries going to the heart. And so we went to the hospital, was checked out, they kept him overnight. And actually the doctor that came in was pretty cool. He was pretty current. He was aware of diet and nutrition to some degree, and he recommended that this person really goes on for a while, a low fat, only healthy fat, moderate fat, mostly plant-based diet, which was pretty amazing. You don't really hear that too much these days in terms of in more conventional medicine. But so he's staying overnight and they bring him his dinner, which was basically all processed food, French fries, Coca-Cola, grilled cheese, and potato chips. So this is after having this conversation with the doctor. And then the doctor came back that night to just do a quick visit, and my client, who's pretty knowledgeable and has been trying to make some changes, he said to him, "Oh dear doctor, you're telling me how I should be eating. I'm having some cardiovascular issues, and do you know what they brought me? They brought me Coca-Cola, potato chips, grilled cheese, and what was the other thing? All kinds of processed food. A salad was really, really horrible, processed, hydrogenated oil salad dressing." So, he challenged the doctor, why in a hospital would you be serving this to sick patients? These foods are known, this guy knows stuff, they're known to be carcinogenic. They're known to be very bad for the heart. They're known to be loaded with bad fats, free radicals, all kinds of problems, chemicals, heavy metals, GMO, all kinds of stuff. So he challenged the doctor, and it was really good because this doctor was actually like, well, you're right, you're absolutely right, because I'm recommending something for you which is completely different than what the hospital is doing. So this is one of the indications of the big problem in our healthcare system, or in the, you could say, pharmaceutical, conventional healthcare system, is that there's so many connections that are not being made or not being acknowledged. And it's actually, these hospitals have all kinds of deals with the food companies, with the Coca-Cola companies, with soda, they have all these kinds of arrangements, and they get things very inexpensively. They have contracts with them, so they are tied in financially, going against very, very basic principles of health. So this is a big problem. So that is why we need to be proactive with our own health and no longer really give up this idea that eating junk food is safe, because it's not. It's like we've all been hoodwinked to a degree. We've all been brainwashed to a degree that it's really okay, and it's causing a lot of disease on the planet. With the amount of toxins, with the amount of heavy metals, with the amount of pesticides, and then you throw on all this fake processed food, it's a big problem. And even in the plant-based world, they're coming out with all kinds of burgers that are really, really unhealthy. So we have to read the labels. We have to focus on what is really optimal for our health and our well-being. So I just wanted to mention that story today. Okay, have a great day.